welcome to my channel. Today I'm going to talk about my birthing story and a little bit about Chorioamnionitis. Now we're going to call it Chori for short, and with Chori you have two types. You have clinical and then you have subclinical. If you see me looking this way a lot, it's just because I have notes so I can stay on track and give you the correct information. Now back to the Chori. Clinical Chori is a little less common and it affects pregnant women. I meant to say a more serious infection and not violent. I'm sorry. Violently or dangerously, I guess. A lot of the symptoms with the clinical Chori is a maternal fever. You have a fever while carrying. You have tachycardia, which is a high heart rate. Your uterus is kind of tender during orgasms or anything like that. It would be really painful. And plus preterm rupture of the membranes, preterm labor. Now, subclinical is more common. A lot of the symptoms are the same, and the subclinical is kind of just more of an inflammation kind of thing rather than a potentially deadly infection. It's hard to detect, and most times Chori isn't diagnosed or detected until either after delivery, when the placenta is sent to pathology, or pretty much right at term when somebody starts to have these symptoms. Now, no one really knows what causes this. A lot of people think it has to do with anaerobic bacteria, tiny microbes that go through the vagina, into the cervix, into the uterus, into the amniotic sac through maybe a tear or something like that. A lot of times doctors do an anaerobic culture around 30 to 34 weeks, and a lot of women with subclinical Chori, it will come back positive with anaerobic bacteria, and a lot of times that will give them an indicator if they have Chori or not. Now, with my Chori, I had clinical Chori. I had the more rare of the two and the more serious of the two. All my cultures, every lab I had, came back normal except for my platelets. I had an extremely high platelet count. At 36 weeks, I had an appointment with a hematologist to discuss this and figure out what was going on because I had no other symptoms of the Chori as far as blood work goes. Now, I would get random fevers. My heart would race, like it would beat out of my chest. It would beat so fast, it would almost feel like it was vibrating. I would get lightheaded and dizzy, but my blood pressure was not high. I also had extreme uterine tenderness. With sex, anytime that I had an orgasm or anything, it would feel like I would have insane contractions. So back to the day that I had an appointment with my hematologist. It was 7 o'clock in the morning. I was getting ready to get dressed. It was November 25th, 2015. I was almost at, or maybe right at 36 weeks. I had a cramp, but I thought I had to use the bathroom. So I went to the bathroom. Nothing happened. I didn't have to go. I stood up and I felt something running down my leg. I knew it was not pee because I had just peed. Well, the cramps didn't stop. They were getting stronger and stronger. I knew I was going to the doctor anyway. David had just left to go drop his dad off something, and he was coming back to the house. Well, he wasn't even gone for 5 minutes, and I called him. I said, something's not right. I need you to come back. We need to head to the doctor's now. 10 minutes later, I went in his truck, and my water completely just gushed, broke. It was like a river in the truck. That's when things started to get real serious. Ryder stopped moving. My contractions were 45 seconds from start to start, and it was the most extreme pain I had ever felt in my entire life. Long story short, we get to the hospital. By this time, It's around 10 a.m. They've noticed that he's also not moving. His heart rate was going up, and with every contraction, his heart was almost stopping. So they did a biophysical, which is like it's a sonogram that checks the fluid amount that is in your amniotic sac to make sure the baby isn't dry, because you don't want to go into dry labor. That's a different story for a different time. Well, he had no fluid left at all. He did have a full bladder, but he wouldn't pee. So from working in OB for so long, I knew what was about to happen. I knew I was going to get a C-section. I knew there was something wrong, no matter how nice they wanted to be or how much they wanted to hide it. 10 minutes later, my doctor comes in, who was also my boss for 7 years, tells me what's going on, tells me that I need a C-section, I need it now, we're ready to go into the OR. So by this time, we're all scared because we know something's wrong. I don't want to cry. Ryder's fine. He's great now. But just reliving it is terrifying. So I wasn't even numb all the way. They had just given me the epidural, and the anesthesiologist told the doctor, I need 5 more minutes to make sure that she is numb. The doctor said, we don't have 5 minutes. I have to get him out, and I have to get him out now. I started to go into a panic once we got into the OR, and before they let David in, Dr. Ali was talking to me while they were strapping me down, getting me ready, telling me that I know I'm in good hands. He's not going to let anything happen. He sees me as family. Everything will be okay. In about 10 minutes, they had Ryder out. He was 5 pounds. He couldn't even cry. He could barely cry. It sounded like a squeaky toy. I didn't get to see him. I didn't get to see him until 24 hours later. He had to go straight to the NICU to be on IV antibiotics because he was very sick, and there was a chance that he would not make it. I prayed and prayed and prayed. Luckily, everything was fine. He was in the hospital for 2 weeks on IV antibiotics. They drew his blood every day to make sure that his white blood count went down. Once it got to a normal range, they would release him, and it took 2 weeks for that to happen. Now, long-term side effects of Chori. There are some long-term effects, and there are some immediate effects after birth. For the baby, clinical Chori, the more rare, more serious of the two, can cause renal failure in the baby. It can cause heart and breathing issues. It can make them prone to lung infections. It can also give them some neurological issues. And a lot of people have linked autism to Chori. A lot of people also, if they go into preterm labor and they have the clinical Chori, they can have a stillbirth. And when they sent my placenta out and it came back positive with clinical Chorioamnionitis, the house doctor that day that was doing rounds, checking on my staples and everything, told me that if I didn't go into labor that day, my child would have been a stillborn. He would have not been here with us. I can't tell you how lucky I am to have him and just to have everything go so great. I just want to raise awareness of this because not a lot of people know about it. Not a lot of doctors know about it. When Ryder had his first doctor's appointment outside of the hospital, I explained to his pediatrician that I had chorioamnionitis, and I just want to make sure that he wasn't affected. And the doctor had no idea what I was talking about. He had never heard of it, nothing. So that's why I wanted to make this video. I wanted to share my story with you guys and hopefully bring awareness to you. And if you have any questions, please do not hesitate to ask your OB. I'm sure if they don't know about it, they will do research. There are a lot of articles online. There's not too many studies, but there are a lot of articles online that explain what it is, what it does, the effects, long-term, short-term. And also, another thing is that it only affects first-time pregnancies. So if you're having number 2, number 3, number 4, number 20, you're not going to get it. It only affects first-time pregnancies. So if you've made it this far, thank you for watching. I know it's unedited, and I hope that you guys have a great day. And this is Ryder Now, a healthy 2.5-year-old. You can find some more information on Google that will link you to more studies about Chori. Thank you for watching.